So the primary duties of the World Health Organization is to really ensure that there's a good understanding of outbreaks that are taking place all over the world. And through the World Health Organization, we really can monitor epidemics and pandemics as they start to arise. So one such case is that of monitoring influenza, which we talked about earlier, really has a lot of holds and origins in Asian countries. So one of the focuses of the World Health Organization is to kind of monitor and track these cases as they arise, because our world is so integrated in terms of travel. You can't really inhibit individuals from traveling like they inhibited Typhoid Mary in the 1900s by arresting her. So humans are, we're so globalized now that we have this constant communication that has been, communication channels that have been open between countries, between individuals. Businesses are constantly trading materials and services. So individuals residing in this region are integrating with individuals in this region. And because of that integration, there's a high chance that you can have a transmission of different influenza strains. And so what this map is showing is essentially outlining affected areas that have shown cases of humans that have been infected with the avian influenza since 2003. And you can see areas where we have confirmed cases really highlighted in this region here. So in looking at this map, individuals working with the World Health Organization kind of have to map out and kind of put together the pieces of the puzzle that will allow us to determine why is it we have a high concentration of confirmed human cases here, none in this area here, and then a few spots here. So there's something had to have happened, some sort of what was the mechanism of transmission? Was it through trading practices that occurred in the Middle Eastern region here between Asia, or was it just, individuals moving or relocating from areas here? Could it have been individuals working in these locations that originated here, such as missionaries that might be working in the areas? So those are kind of things that we would look for to kind of understand the pattern of transmission if we were taking on this role to study these infectious diseases as they're being transmitted from population or from region to region. Other agencies that play a role and assist the World Health Organization in doing what it does are things like the Center for Disease Control, which is the U.S.'s big federal agency that falls under the Department of Health and Human Services. And this is an organization that is based in Atlanta, Georgia, and it's basically the key location for the study of infectious diseases and agents, not just in a laboratory clinical kind of setting, but also in the epidemiological sense, where we're studying the transmission of diseases throughout the population. The CDC produces a weekly report that's called the MMWR, or referred to as the MMWR. This stands for morbidity and mortality. Remember, morbidity talks about the incidences and prevalences of an infectious outbreak or infectious disease in the population, and mortality talks about the rates of individuals that have been impacted by a new infectious agent. These are the major diseases that have come out of the population or infected the population in 2002. Again, this is kind of old data, but still kind of a key example of what the CDC does. They monitor and look at all of our health data, and then they put them together in little graphs so we can understand essentially what ran rapid at those particular time frames. So in 2002, it looks like diseases of the heart constituted 28% of an infected population. Malignant neoplasms, cancer took up 23% as a deadly disease in 2002. There's also some very small windows of different diseases, such as chronic liver cirrhosis, septicemia, which is simply contamination, nephritis, nephrotic syndrome, anything regarding to the kidneys, about 2%, Alzheimer's disease, 2%, diabetes, mellitus, 3%, chronic lower respiratory diseases, 5%. So it looks like a lot of these, don't take up a lot of chunks of the pie chart versus these more complicated diseases such as cardiovascular disease or cancer. So what does knowing this information help us to do? Well, this knowledge of this information helps us to respond to these diseases and helps us to kind of figure out what our trajectory is in terms of the science and research that's needed to kind of alleviate these burdens on our population. So that leads us to prevention and control epidemics. So what mechanisms are in place in order to prevent epidemics from taking place and to protect lives? And so measures that are taken to do this kind of follow these key points. The one is to increase host resistance by producing vaccines and vaccinating the public to protect them against the chance of succumbing to an infectious agent. But through vaccinations, we can develop what's referred to as active immunity or herd immunity. And if many people are vaccinated, then the herd immunity is strong. And so when there is a virus outbreak, an individual's immune system will know how to respond to that outbreak and be quicker in terms of fighting the infection. We want to make sure that individuals that are exposed to a pathogen are protected against the disease. So this is going to be could be as simple as education. It could be as simple as having access to health care, making sure that safe sanitation practices are followed. Individuals that have contracted a particular infectious agent need to be segregated and isolated, and they need to undergo treatment that's effective. And then lastly, we want to identify the reservoirs to which these pathogens are originating from. So we need to control insect vectors. So we need to make sure that there aren't any stagnant water pools that can allow mosquitoes to flourish. So these kind of control mechanisms we want to implement those to prevent epidemics from taking place. Vaccination right now is our biggest kind of tool that's used. If you look at this timeline that's here, we're essentially having a large number of cases exist in the population, and if you look from January to beginning of February, it doesn't look like we have a whole lot of cases that have occurred. That is due to lack of vaccination. And so vaccination starts here at on February 23rd, right? So vaccination continues to ensue all the way to May 11th. And so preventing an outbreak through vaccination is considered to be the ideal mechanism or ideal strategy to use, because when we don't have any vaccination, look how high our cases jump. So cases at 16, when compared to vaccination that's followed by WHO guidelines, we're seeing 2,000 cases when individuals have been vaccinated. So this is among individuals who have not been, who in the population not vaccinated. But in comparison to those without vaccination, we're looking at about 6,500 individual cases that start to form. And this could be any disease that's running rampant. But the truth of the matter is, the more that you vaccinate individuals, the lower your case incidence is going to be, which is what we want to shoot for. So this is why vaccination is pretty critical, because it helps to minimize the number of cases of diseases that can occur in a population, giving them what the vaccine is targeted for. So let's move on to bioterrorism and biological warfare agents. Any agents that are used during wartime as a weapon that can be used to take out the enemy are referred to as biological warfare. And there have been some countries that have kind of played with this idea of biological warfare throughout history. The United States used to have a biological weapons program. The Soviet Union had a biological weapons program. South Africa had a biological weapons program. And so these weapons programs were generated to be used as strategies to fight the enemy during wartime and to incapacitate soldiers that were combating each other. So that's biological warfare, and that could be something as simple as generating a mass quantity of bacterial cells and disseminating them through an airborne release mechanism, and then having the soldiers inhale those microorganisms and then succumbing to infection. And the key kind of weapon that has been thought to be used is typically an organism that can generate endospores. So something like Clostridium botulinum, which can be incredibly deadly, as well as Bacillus anthracis, which, if you remember, the anthrace letters that followed the events of 9/11, kind of refer to those as agents that have been used in history as biological warfare agents, or at least the attempt to use them has been there. Now, pathogens that are used for nefarious purposes are pathogens used to generate fear, chaos, illness, as well as death, targeting specific groups of people or specific individuals. So people such as biological terrorists will use bioterrorism agents like Bacillus anthracis or Clostridium botulinum to induce fear, to induce chaos. There's a kind of expertise that is really needed in order to develop bioterrorism agents, and those specific expertise make it very difficult for organizations to actually create bioterrorism agents in something like their kitchen or their garage. There's a lot of controversy regarding just how easy it is to generate deadly pathogens such as this, because as we've talked about with bacteria in this class, they can grow very, very rapidly. And so with rapid growth, you can also get mass proliferation. But there's a lot of factors involved that kind of prevent or help to thwart these agents from being used. And some examples include the idea just that Bacillus anthracis and Clostridium botulinum are very, very deadly, and so anybody that's working with them can easily expose themselves or their work organization to these particular agents if they don't take the necessary precautions when using them. And things like smallpox virus or Yersinia pestis also are examples of agents that could potentially be used as bioterrorism agents. So anybody who has the sick mind to undergo and incorporate these agents for use as bioterrorism weapons or even biological warfare can be faced with a lot of challenges because these organisms are very fastidious and they're very picky about their environmental conditions in which they reside to grow and develop. But the kind of whole point of this is just to make sure that we're aware that it is something that we want to be alert on, because you can collect these organisms from nature. Bacillus anthracis can be found in spores that are residing in the soil, so you could take a soil sample and collect this agent. And if you had a harsh mindset, you could turn it into a bioterrorism agent, assuming you had all the other resources that were involved in allowing the Bacillus anthracis to grow and mature. So So that's a little bit about bioterrorism and biological warfare agents. We won't spend too much time on that because I could spend all day talking about these particular concepts.